Yes, now I'm going to share the video. Yeah, here we go.
Here, I'm going to timestamp these categories down in the description so that way it's easier to click on the ones you want to review. Don't forget to turn on the captions as well and read along. This will help with learning and retention. And as always, you can find the notes and charts. So starting, we're going to name as many as you can and then see how many you get right. So starting with AMA, that stands for Against Medical Advice. DC stands for Discharge or Discontinue. DNR, Do Not Resuscitate.
Discharge, usually this is the summary the patient get when he is discharged, and this short form is usually used D/C.
HMP, History and Physical. HPI, History of Present Illness. HO, History of. NKDA, No Known Drug Allergies. PCP, Primary Care Physician. A&O, Alert and Oriented. WNL, Within Normal Limits. RF, Risk Factors. SX, Symptoms. DX, Diagnosis. TX.
Now this TX, where have you seen this TX? You must have seen this TX. This is
on the prescription.
exactly
On the prescription.
exactly good, excellent. A doctor will start with TX always, right? And after below that TX, he or she, the doctor will write the prescription, whatever test that the patient is supposed to undergo. This is very common, which all the patient usually know about.
Treatment. NAD, no acute distress. UOP, urine output. I&O, intake and output. CO, complaint of. CC, chief complaint. ROS, review of systems. Next, we have another round of abbreviations you might see with charting. Again, hit pause in the video and try to name as many as you can, and then check your answers. DDX stands for Differential Diagnosis. MDM, Medical Decision Making. IBW, Ideal Body Weight. DOB, Date of Birth. ICU, Intensive Care Unit. MVA, Motor Vehicle Accident.
Again, this abbreviation is very common. ICU, right? Intensive Care Unit.
GSW, Gunshot Wound. FX, Fracture. EBL, Estimated Blood Loss. BM, Bowel Movement. CP, Chest Pain. SOB, Shortness of Breath. DOE, Dyspnea on Exertion. STAT, Immediately. CV, Cardiovascular. GI, Gastrointestinal. ID, Infectious Disease. SP, Status Post. FB, Foreign Body. ALS or BLS, Advanced or Basic Life Support. Moving on to vital signs, you might see these in charts as well. Again, hit pause and try to name them and then see if you're right. VS stands for vital signs. VSS stands for vital signs stable. BP, blood pressure. HR, heart rate. P, pulse. RR, respiratory rate. T, temperature. SpO2 or SaO2, oxygen saturation.
This was used frequently at the time of COVID. Oxygen saturation, SpO2.
TWT, height and weight.
Yeah.
BMI, body mass index.
This is again common, body mass index, right? We all are aware about. Few abbreviations are very common, but few are known only by the medical staff or the healthcare staff.
Next, we have common lab abbreviations. How many of these can you name before looking at the answers? CBC stands for complete blood count. WBC, white blood cells. RBC, red blood cells. PLT, platelets. BMP, basic metabolic panel. CMP, comprehensive metabolic panel. LFT, liver function test. H&H, hemoglobin.
Now, where do you see all this abbreviation? Where do you find all this abbreviation? These are again, most of them are common to us.
Blood test.
Blood test.
Pathological.
Pathology lab. They use all this sort of abbreviation, and most of it are known to us. So I'm going to run the video again.
Hemoglobin and hematocrit. HB or HGB, hemoglobin. HCT, hematocrit. Na, sodium. K, potassium. Ca, calcium. UA, urinalysis. ABG, arterial blood gas. PT, prothrombin time. PTT, partial thromboplastin time. INR, international normalized ratio. TNS, type and screen. TNC, type and cross. In addition to labs, there might also be imaging or other tests ordered. CXR stands for chest X-ray, ABX, abdominal X-ray, US, ultrasound, MRI, magnetic resonance imaging, CT, computed tomography, EKG or ECG, electrocardiogram, EEG, electroencephalogram, KUB, kidney, ureter, and bladder X-ray, PFT, pulmonary function test. Let's move on to abbreviations you might see associated with pharmacy. Most of these have to do with the frequency in which you give a medication. So starting with AC, that stands for before meals. PC stands for after meals. And the way you can remember this is A comes before P in the alphabet. So A stands for before meals and P stands for after meals. QD, once daily. BID, twice daily. TID, 3 times daily. QID, 4 times daily. QHS, at bedtime. QAM, every morning. QPM, every evening. QOD, every other day. QH, once every hour. Q2H, every 2 hours. Q3H, every 3 hours. PRN, as needed. PO, by mouth. NPO, nothing by mouth. SC or SQ, subcutaneous. IM, intramuscular. IV, intravenous. OTC, over the counter. Next, we have some abbreviations for different medications or drug names. Try to name as many as you can and then see if you're right. BB stands for beta blocker. CCB, calcium channel blocker. ARB or ARB, angiotensin II receptor blocker. ACE-I, ACE inhibitor. NTG, nitroglycerin. ASA, aspirin. ABX, antibiotics. PCN, penicillin. TPA, tissue plasminogen activator. APAP or APAP, acetaminophen. NS, normal saline. D5W, dextrose 5% in water. LR, lactated ringers. ETOH, alcohol. HCTZ, hydrochlorothiazide. MTX, methotrexate. OCP, oral contraceptive pill. TMP, SMX, trimethoprim sulfamethoxazole. MOM, milk of mag. PPI, proton pump inhibitor. Next, we have abbreviations for different diagnoses or conditions. Hit pause in the video and try to name as many as you can. CAD stands for coronary artery disease. HTN stands for hypertension. DM, diabetes mellitus. CHF, congestive heart failure. COPD, chronic obstructive pulmonary disease. MI, myocardial infarction. PE, pulmonary embolism. PNA, pneumonia. TIA, transient ischemic attack. CVA, cerebrovascular accident. ARDS or ARDS, adult respiratory distress syndrome. CKD, chronic kidney disease. AKI, acute kidney injury. ARF, acute renal failure. ESRD, end-stage renal disease. CF, cystic fibrosis. CP, cerebral palsy. IBD, inflammatory bowel disease. IBS, irritable bowel syndrome. UC, ulcerative colitis. Let's continue with more diagnoses and conditions. Starting with PUD, we've got peptic ulcer disease, GERD, gastroesophageal reflux disease, ICP, intracranial pressure, TBI, traumatic brain injury, TGA, transient global amnesia, UTI, urinary tract infection, URI, upper respiratory infection, RAD, reactive airway disease, SBO, small bowel obstruction, DVT, deep venous thrombosis, RSV, respiratory syncytial virus, VF, ventricular fibrillation, VT, ventricular tachycardia, AFib or AF, atrial fibrillation, PVC, premature ventricular contraction, MS, multiple sclerosis, PD, Parkinson's disease, BPH, benign prostatic hyperplasia, RA, rheumatoid arthritis, OSA, obstructive sleep apnea. We're down to our last two categories, and we're going to start with abbreviations associated with anatomy. Beginning with the abdomen, it can be broken up into different quadrants, especially when someone is referring to the location of abdominal pain or site of injury. Starting with RUQ, that stands for right upper quadrant, LUQ, left upper quadrant, RLQ, right lower quadrant, LLQ, left lower quadrant, and then we're going to move on to the different chambers of the heart. RA stands for right atrium, LA, left atrium, RV, right ventricle, LV, left ventricle. And as we move to the extremities, RUE, right upper extremity, LUE, left upper extremity, RLE, right lower extremity, LLE, left lower extremity. And then going back to the abdomen, ABD stands for abdomen. The lung fields can be broken up and abbreviated as well. LUL or LLL stands for left upper or lower lobe. RUL, RML, RLL stands for right upper, middle, or lower lobe. CBD stands for common bile duct. OD, right eye. OS, left eye. OU, both eyes. HC, head circumference. Let's wrap this up with abbreviations you might see associated with treatment or care. Again, hit pause in the video and try to name as many as you can. BX stands for biopsy. ECMO stands for extracorporeal membrane oxygenation. FNA, fine needle aspiration. IND, incision and drainage. PT, physical therapy. OT, occupational therapy. PEEP, positive end expiratory pressure. CPAP, continuous positive airway pressure. BiPAP, bilevel positive airway pressure. CABG, coronary artery bypass graft. IVIG, intravenous immune globulin. ORIF, open reduction internal fixation. NGT, nasogastric tube. Pre-op, preoperative. Post-op, postoperative. POC, point of care. AKA, above the knee amputation. BKA, below the knee amputation. PPE, personal protective equipment. IUP, intrauterine pregnancy. These were some of the
Yeah, so this were few of the abbreviation which usually doctors know. As an MBA student, we will not be knowing all the abbreviation. It is not needed also. In fact, the nurses will be studying few abbreviations which are usually should be able, the nurses should be able to understand. Because these abbreviation were related to anatomy, right? It was related to treatment and care, which the doctor, all the doctors are supposed to know all these abbreviation. I ask you a few questions regarding the abbreviations which were segregated based on the treatment, based on the lab abbreviation were there, lab abbreviation were also there, right? So I would just want to ask you a few questions related to this abbreviation. Now, what does MRI stands for? MRI.
Magnetic resonance imaging.
Yeah, magnetic resonance imaging, right? Imagining, imagining, right? Then what does again very simple PC? What does PC stands for? It was just in the start beginning. PC, and I'll tell you it is after meal, right? Then QHS, that was related to medicine. QHS lab, it was mentioned in lab. No, it was for what? Prescription. OHS, at bed, at the time of bedtime, at bedtime, right? OT, what does OT stand for? OT doesn't stand for operation theater. One of the another full form of OT is occupational therapy, right? Another very simple I'll give you is what does K stand for in lab abbreviation? K.
Potassium.
Potassium. Good. Excellent. Excellent. Fine. Now, this all the abbreviation is not practically possible for us to remember because those people who are working in that particular environment, particularly doctors, because they are associated with a prescription, they are associated with lab tests, they are associated with anatomy of the patient. They are supposed to know all this abbreviation. But another video I'm going to show you on the same abbreviation, which the staff should be knowing. These are very common, which again we might be knowing and not knowing because but as a staff, as a nurse, I should be knowing it. So here we go with this very simple abbreviations. This is should be known by all the registered nurses. This abbreviation was supposed to be known by the what pharmacists and the nurses who are what treating the patient. Few abbreviation which were used here. What does I'm going to ask you a question? What does RX stands for? RX. It was medical prescription, isn't it? A very simple question again. What does uh, what does RX you have said SOS stand for? SOS.
Emergency.
Yeah, if necessary in emergency. Good, good. A very simple one. CAP. What does CAP stands for?
Syrup.
CAP stands for capsules, isn't it?
Capsule.
Yeah, and TAB
Tablet.
tablets. Excellent. So basic things we should be knowing. That's why I've shown you this particular video, and I'm going to share the link also. I've already shared the link of earlier video. This you can go repeatedly so that you can remember most of the abbreviations, which is usually not needed many times as an MBA student. I'm saying. This is another link I'm sharing in the chat box. You can just download it and watch it later on, right? So let us move back to our topic, which we were discussing yesterday. Few more videos I have come out for you people. Again, I'll be showing you those videos and I'll be asking simple questions at the end of the video. Okay. Talking about one video is from AIMS Delhi. First of all, I think I will. Can you see it? I don't think you'll be.
No, sir, we can see the PPT presentation. What is the importance of good communication?
Stop sharing and reshare. Yeah, it does. Right. Now you can see it.
Yes, sir, WHO Collaborating
Collaborating
Center.
for Trade. This is AIMS
Yeah.
New Delhi. They have prepared it. How to segregate waste and how to dispose it off in a scientific and smart manner, right? In an appropriate manner. So here goes the video. At the end, I'll be asking you few simple and small questions.
In this video, we shall learn about biomedical waste segregation and its disposal. Waste is generated by healthcare activities and includes a broad range of materials. These are used needle and syringes, soiled dressings, body parts, diagnostic samples, blood, chemicals, pharmaceuticals, medical devices, and radioactive materials. Proper disposal of waste is important to protect the healthcare workers, the patients, and to keep our environment clean. It is important to segregate the medical waste materials at the point of generation, treat them appropriately, and then dispose them off safely. The World Health Organization has classified medical waste into 8 main categories. They are general waste, pathological waste, radioactive waste, chemical waste, infectious to potentially infectious waste, sharps, pharmaceuticals, and last but not the least, pressurized containers. All health professionals should be well conversant with their local hospital policies for waste disposal, which may vary from one place to the other. Commonly, there is a color coding for disposal of biomedical wastes. Drums with black, blue, and yellow polythene bags are used to segregate different types of waste, each one of which has to be disposed of in a different way. Some hospitals use 4-colored bags for waste disposal. We have to refer to individual hospital policy regarding the waste disposal in these scenarios. The black bag is used for collecting dry waste material which is not infectious. The items to be included are the leftover food, fruits, feeds, vegetables, waste paper, packing material, empty box, bags and wrappers of cannulae. This waste is disposed of by the routine municipal council committee machinery. On the other hand, yellow bag is used for infectious but non-plastic waste. This includes blood-stained cotton, blood, body fluids, placenta, etc. This type of waste requires incineration. The items to be disposed of in the blue bag include all the infected plastic waste, just as disposable syringes, the intravenous set, the blood transfusion set, the endotracheal tube, urinary catheter, urine bag, medication vials are to be disposed of in the blue bag. The IV set, the blood transfusion set, the endotracheal tube, the catheter, and the urine bag should be first cut into pieces and disposed of in the blue bag. Needles after destroying in the needle destroyer, used sharps, IV cannulae, blade and broken glass should be discarded in a puncture-proof container before disposing it off in the blue bag. Biomedical waste is also collected in the blue bag. The biomedical waste should be autoclaved to make it non-infectious. This is then shredded and disposed of. What are the benefits of biomedical waste management? The surroundings are cleaner and they are healthier. There is a reduction in the incidence of hospital-acquired and general infections. There is a reduction in the cost of infection control within the hospital. It also reduces the possibility of disease and death due to reuse and repackaging of infectious disposables. The incidence of community and occupational health hazards decreases to a considerable extent. The cost of waste management and the generation of revenue through appropriate treatment and disposal of waste is also reduced. Last but not the least, it improves the image of healthcare establishment and increases the quality of life. Thank you.
Fine. That was all for this particular video. I do not know a timer is coming over here. Remaining time for the meeting 6 point. Earlier it didn't appear earlier session. I think it will get over will it get over automatically? I'm not aware about it. Anyway,
Before 10 minutes it starts, sir.
but we started at what 1 o'clock, so it should go till 2 o'clock.
Maybe it is a 40-minute session.
Okay, but I was communicated that it's going to be 1 hour. But anyway, if it stops, then we'll conclude at that point only because I do not know how to extend it. My question for this particular, see, first of all, I'll share the link of this to you.
Sir,
Yes, yes,
sir, we can join through same link now if
yeah,
class ends.
that we can do. If you get disconnected, then try to join through the same link. Okay, fine. Anyway, the question
Yes,
related
sir.
to if you get disconnected, try to join through the same link. Okay, fine. See, the question related was yellow bag. What exactly goes in yellow bag? Because these are the standards established by WHO, World Health Organization, and most of the hospital follow this code, color code, for disposal of the waste. Yellow bags. What was going in yellow bag?
Infectious non-plastic material.
Then blood stains, right? Blood
Yeah,
fluid.
body fluids, placenta, diaper,
Exactly.
like this.
And how it was disposed of? Through incarnation, right? By burning it.
Incinerated.
Incineration.
Sorry, it is through incineration, right? Incineration is needed, which is where they are actually burned in a what incinerator. Okay. Blue bags, blue container. What was going in that?
Biomedical waste.
Plastic related, latex related, ET tube, IV sets.
Yeah. Then
Syringes, urine catheters.
exactly, medicine wires, then syringes, right? All sort of biomedical waste. Good, excellent. Fine. Let us move to another video.
But have to cut into small pieces.
Exactly. They need to be cut into small pieces, put in a container, and then that container will go in the blue container. You put it in small container, seal it off, and then put it in the blue container. So this is how you are supposed to segregate it in three parts. Okay. Fine. Another video which will again clarify.
Sir,
Yeah. Yes.
Sir, I want to ask one question. There was a term that is
टी से खत्म टिटनेस
pressurized container.
याद
So
रहेगा
what is it?
Pressurized. Yeah, they have used that word for what? It was related to, I think.
Autoclave, autoclave.
Yeah, yeah, yeah. So it is used
Autoclave.
for what sort of waste? Just a moment. Fine, we'll have discussion. Yeah, this is a wonderful video. After this, we'll have a discussion on this waste. I'm going to play it for you. Please share. I think the meeting is going on, still going on, right?
Yes, sir.
Okay, okay, fine. So we'll not worry about rejoining. Uh, remaining time now it is showing 3 minutes. I do not know. Fine. Anyways, I'm going to play this.
अरे ओ नीले पीले डब्बो, जरा बताओ तो हॉस्पिटल में कितने तरह का कचरा होता है? हाँ?
हॉस्पिटल में 4 तरह का कचरा होता है सरदार।
सुन लिया ना जितेंद्र बाबू?
हाँ, ये तो मुझे पता है, पर प्रॉब्लम ये है कि किस बिन में क्या डिस्पोज करना है, ये कैसे याद रहे?
जिम्मेदार डब्बों, समस्या क्या है सुन लिया ना तुम लोगों ने?
हाँ सरदार।
हाँ सरदार नहीं, तरीका अपनाओ असरदार। अरे तो अब शुरू हो जाओ।
मैं हूँ वाइट यानी कि उजला, निडल सुई शार्प, कुछ भी हो नुकीला, सब ऐसा वाइट का ही है झमेला।
बहुत अच्छे।
आईवी नली, प्लास्टिक, थैली थैला, सब लाल में ही है धकेला। ओह क्या भूले, क्या गलती हुई, सिरिंज बिना सुई।
Yes.
Now see here the coding has changed. In fact, it may be confusing to you people, but it depends from hospital to hospital. All that is needed is you have to segregate the waste. You have to segregate that coding you can follow according to your convenience. That's why don't be under confusion. Sharps, needles will go in one particular type of coding, and remaining just now as it's shown, syringes and all those things will go in another, right?
हे, क्या बोले भाई? मैं हूँ पीला, प से पीला, प से पट्टी। नहीं, अपन ऐसे बोलेगा, टिश्यू कटेला फटेला, खून से सनेला, पुरानी दवाई का हो झमेला, या केमिकल का लोचा, इसका उपाय सोचा, तभी तो पीला लगाया। समझे मेरे भाया?
समझे?
हाँ हाँ।
अब आई मेरी बारी। अच्छे से कर लो जांच, नीले में हो शीशा और कांच।
समझे? शाबाश। हाँ? अब तेरा क्या होगा रे कालिया? तुम्हारे लिए अलग से कार्ड बनवाऊं क्या?
नहीं 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 सरदार, दरअसल हम इस बिरादरी में नहीं हो ना, पर हम काले हैं दिल वाले हैं, म्यूनिसिपैलिटी का जनरल वेस्ट ले जाने वाले हैं। सरदार।
अब समझे आप, या अभी भी मन में है कोई डाउट?
नहीं नहीं, अब नहीं है कोई डाउट, कंफ्यूजन सारी हो गई है आउट।
टोटो खुश हुआ।
Yes, Das Gupta, yeah, it got disconnected. Anyway,
Yeah. I have joined.
yeah, you're back. Fine, fine, good. Let others join.
Yeah.
We'll start. We'll start with our new
Okay, sir. Okay,
yeah,
sir.
new topic.
Okay, sir.
Yeah. Yeah. Snail has joined and Das Gupta has joined. Fine. Let us start our session. Just a moment. I'm going to share my presentation. Now, this is unit 3. Up till 2 units we have covered, not exactly in detail, but if we are left with time, then we'll be going into the detail of other part of those unit also. Unit 3 talks about hospital environment and its impact on patient satisfaction. Earlier also we have seen what was a hospital environment, what were the attributes or what were the characteristics that constitutes the hospital environment and how it impacts the patient. Like we have seen noise, we have seen disposal of waste, and how, if this is done correctly, how this is going to impact the patient's satisfaction. This is unit 3. So let me take you to the first slide. Hospital environment, we all know, right? What does it constitute of? A safe hospital environment is considered to be an environment in which the comfort and safety of both patient and medical staff of a health facility is provided. It is not only for patient, but as well, patient is a focus of everything. It is a epicenter of everything. But medical staff is also equally important, and they both should feel at comfort, and they both should feel at safety. Such an environment is created by event of certain nature, infection control mode, and ensuring patient hygiene. So let us move further. Why it is important? Why is hospital environment important? We have seen this, right? And hospital
Sir,
environment, yes, yes,
sir, sorry to interrupt, but I'm not able to see your slides
actually you are not able
actually.
to. Fine. Let me reshare.
Yeah.
Just a moment. Just a moment. Yes, now you can see it.
Yes, sir.
Okay, good. See, this is unit 3, hospital environment and its impact on patient satisfaction. How this hospital environment, if it is maintained properly, if standard rules and regulations are followed, and discipline is maintained, then this is going to lead to what? It is going to impact the patient. The patient might get satisfaction, or the patient will be what, cured earlier, and this may lead to dissatisfaction also. So what exactly is, yes, Dasgupta, you want to say something?
Sir, is it first slide?
Pardon me?
Is it the first page you are
Yeah, this is the first page.
presenting?
Yeah, this is the first page. This is second. This
Okay,
is,
okay, sir. Okay.
yeah, see, yeah, this is the first page. In fact, you are seeing the first page only. Now, what is hospital environment? We have already seen it. What are the attributes we have seen it? It includes building itself. It includes the reception. It includes the patient room, right? It includes consultancy cabin where the doctor will check the patient. So, lot many factors. It includes the ambience also inside and outside the hospital. And if it is maintained properly, if certain rules and regulations are followed, certain standards are followed, then this is going to lead to what? It is going to have an impact on the patient satisfaction. So we have earlier seen this, what is hospital environment and why it is important. We all know. It is important from both the patient point of view as well as the medical staff point of view. And how does hospital environment leads to or impact on patient satisfaction? I'll be coming to this also, patient satisfaction. How do exactly we define it? There are some evidence that built environment of an hospital can influence the healing process. Healing process. How rapidly the patient gets healed or recover from the particular problem or disease which the patient is facing. This environment has a very positive impact or positive effect if it is maintained properly, and negative impact if it is not maintained. If everything is shabby, if everything is messy, things are not being followed, no discipline is there. It is discipline is also part of the environment. right? This is what we have seen. In fact, we have seen two types of environment: micro level environment and macro level environment. So here, micro level environment is important when we talk about the safety and health of the patient as well as of the medical staff. The hospital environment, it can have a direct impact on the patient outcomes, including, for example, reducing level of anxiety. Noise, we have seen noise increases the anxiety level of both patient and the medical staff, including doctor. And stress, it induces anxiety and stress, shortening the recovery period from surgery through enabling views of nature, increasing social interaction through improved positioning of furniture. So this all ambience comes into picture when we talk about the hospital environment. It does do have a positive impact if the hospital environment is positive, right? So 8 essential elements of patient satisfaction. Now, when will the patient get satisfied? Simple answer is if he or she recovers fast. With what? See, I've used two keywords last time: efficiency and effectiveness. Effectiveness talks about less defects, less wastage. I'm to say talks about cost, and efficiency talks about speed, right? Efficiency is nothing but the process when the patient is admitted and the time duration when he or she is discharged. So the lesser the duration of the patient stay in hospital, the satisfaction level is going to go high. The larger the stay, the fatigue and the anxiety, all those sort of things, stress will be induced in the patient as well as relatives. Even the medical staff might get that fatigue if the patient has to stay for a longer duration. So efficiency and effectiveness both has to be taken care of when we talk about patient satisfaction. All of you following me? I hope I'm being understood.
Yes, sir.
Okay, good,
Yes, sir.
good, excellent. Fine. 8 essential elements of patient satisfaction. What are those? These are very important. First is communication with nurses. See, nurses usually are the interface between the doctor and the patient. Many a time the doctors will take around and talk to the patient, but nurses stands as an interface between the doctors and the patient, right? Many of the instruction the doctor will be passing on to the nurses, and in turn the nurses will be following those instruction on the patient. So nurses are very important when we talk about patient satisfaction, because they are the actual medical staff who are going to treat the patient. Doctor is going to diagnose the patient, whereas giving the syrup, giving the tablets, giving medicine, will all capsules and all those things will be in the hand of nurses, and nurses has to follow the set prescription given by the doctors. Then second, communication with doctor, because doctor won't be frequently communicating with the patient. Once in a while or twice, दो बार राउंड लेते हैं डॉक्टर या एक बार लेते हैं, तो even that communication is important, but that is kept on second. The reason being the communication is limited when we talk about patient satisfaction. Communication about medicine, that what to consume, when to consume, how much to consume, right? So this communication has to be correct. Many times, see, all the prescription won't be given by nurses. Many prescription which are not that important will be told to the patient, and patient on their own can go for those. But very important medication, usually it is what it is delivered by the nurses. So responsiveness of hospital staff comes on fourth. How quick the hospital staff, like ward boy and the reception, how quick they are how quick they are able to solve the doubts and problems of the patient. Pain management. Fifth is what? Pain management. Here, the onus lies on the nurses. Sixth is, we have already seen it. Cleanliness and quietness, noise, we have seen it. Cleanliness and quietness of the hospital environment. Seven is discharge instruction. How the patient is discharged, and what are the procedures that are followed. And eighth one is overall hospital rating. See, even for educational institute, there are there are agencies, government bodies, government organization who rate this educational institute. NAC is there, which rate educational institute. Similarly, can you name the agency which usually takes cares of hospital, which is the apex agency? Dasgupta, which agency usually will monitor whether the hospital is doing the right thing or not? Anybody in the group know about it? Pardon, you can put
Nabha?
NAPH,
NAPH. What?
NABH,
Pardon me? Put it
NABH, NABL,
yeah, put it in chat box along with full form.
NABH.
LA, put it in chat box.
Yeah.
NABH, yeah. And the full form of NABH, good, Dasgupta. NABL, right? NABH, like we have NAC.
National Accreditation Board for Hospital.
Hospital, exactly. See, something similar to NAC, National Accreditation Board for Hospitals. These agencies will rank the hospital based on different parameters and key indicators. They will give the hospital key indicators. Probably most of the time it is ranked on these seven things. Eight essential elements bole hai, but the seven parameters, something similar to NAC. NAC also ranked the educational institute on seven parameters. So they will, and these seven parameters are further broken down into smaller key indicators. Where, like when I say cleanliness and quietness of the hospital environment, it will be sub broken into what waste management and noise management, all sort of thing, and the accordingly, the NABH is going to rank the hospitals so that the patient knows which hospital stands where. So this is a very important agency which will take care of overall hospital ranking. So based on this ranking, you get a wide gaze, or you'll come to know, fine, this standard, this hospital is of this standard, and getting admitted in this hospital will be good for me. If the ranking is not good, then definitely the patient can think twice about getting admitted to this hospital. Okay, so you have to remember this particular agency. It's a government organization, NABH. Okay, fine. Let us move further. Improving patient satisfaction, or improving patient experience. See, satisfaction will is the end point. Sir, nowadays some hospitals are taking JCI, QAI audits. Yeah, audits. Even ISO. Many hospitals go for ISO certificate, which again proves the authenticity of the hospitals. How good they are in whatever thing they have claimed. ISO stands for Indian Organization for Standardization, right? So, what does JCI stand for, Dasgupta? JCI? I'm not, because I'm not aware of JCI.
Joint Commission.
Joint Commission. Okay, fine. And QA, I think it must be quality assurance, isn't it?
ACI is Joint Commission International.
International. And QA, what does QA stand for? Quality assurance? QA?
Yes, sir. Yes, sir.
Yeah, okay, good. So,
Quality Accreditation.
Quality
Accreditation.
quality accreditation.
Quality Assurance International.
Quality assurance international, right? It can also be done through ISO, which is again stand for a quality. Whatever claims the hospital is making, if those claims are satisfied, and accordingly ISO certification is issued to that hospital. So multiple type of rating agencies are there, and the hospital is at liberty, but NABH is mandatory for almost all hospitals. In fact, it is recommended that they should go for NABH. Okay, now talking about patient experience, how the hospital is going to enhance the patient experience. It will be through these three keywords: people, process, and place model. It is also called as 3P models. What does people stand for over here? People stands for all the medical staff who are directly or indirectly in touch with International Organization for Standardization. Yes, ISO stands for International Organization for Standardization, not Indian. Right? Correct, Radha. But you have corrected me. Fine. Anyway, let us talk about this 3P model. See, this is part of marketing only. See, marketing we talk about 7Ps because physical product is there. But all of we know hospital is typically a service industry where you do not produce anything, a physical product. Patient get admitted and the patient is discharged. All the hospital do is just serve the patient, right? They might be, it can be done through giving proper prescription and then medicine and all those things, through proper treatment, through proper operation, but everything is service oriented. I'm to say nothing is manufactured over there. Patients are treated. That's why when we talk about 7Ps, those 4Ps are all not important. Yeah, 3P, yeah, earlier 4Ps which are related to goods or manufacturing is product, price, promotion, and place, isn't it? And the remaining three are associated with service, people, process, and here I would say physical evidence, ambience. I would
Physical,
say
physical evidence.
physical evidence, right? Or ambience of the which we have seen hospital environment. So your key focus, these are the keywords, and your focus should be on people, right? People means the staff, which is it includes doctors, it includes receptionists, it includes pharmacists if it is present in within the hospital. It includes all sort of staff which is helping the patient to recover, or which is helping the patient to recover directly or indirectly. They are helping it. Doctors and nurses are in the front line, whereas the reception and pharmacists and other vendors, like you need to have a canteen also for patient who are admitted for a larger time, right? So usually most of the hospitals, they do have canteen where the admissions of the patient are done. Now, a model that healthcare and health system leaders use is supported by American Society for Healthcare Engineering. It is also called as AS, its abbreviation is ASHE, right? In order to evaluate and address patient satisfaction, the process is called, the model is called as people, process, and place model. This model assists leaders in developing specific patient-centric ways to improve the patient's experience through cultural change. See, many a time the hospital needs certain cultural change. If you go to Lilavati Hospital, the moment you entered, you will find the Ganesh Lord Ganesh statue over there, just in the right in the beginning. So it's part of culture of the hospitals that people will greet or pray in front of the Lord Ganesha and then enter. This is what is practiced. So each and every hospital, they do have their own culture. So that culture need to be maintained. That culture need to be nurtured, and it needed to be passed on to the workers or to the medical staff which are recruited, newly recruited, right? Process improvement that support patient and staff. So process, how quickly you admit the student, admit the patient, and how quickly you are able to discharge. So that is process, right from admission to discharge. And making enhancement to the hospital physical environment. Physical evidence भी बोलते हैं marketing में. It is how the hospital management is able to enhance the experience, enhance the ambience of the entire hospital, so that it gives a comfortable and cozy feel to the patient as well as to the relatives. So remember this model, 3P model. People, we talk about teamwork makes the dream work. The people here is the staff, right? So staff plays a major, very, very important role when we talk about patient satisfaction or patient experience. Process, just now I have explained you, clinical and non-clinical staff, both are equally important efficient, to increase the efficiency or to increase the productivity. I can use that word also. Productivity of the hospital is what? Getting the patient discharged as quickly as possible. Probably the hospital should not admit the patient if the disease or the problem is not severe. In severity only the hospital should admit the patient. Okay, fine. And this part will take later on, okay, in our upcoming session, because few of the slides are remaining. I do have a meeting to go, so we'll be discussing about this in our later session. Thank you all of you for joining in. Thank you so much. I hope I'm being followed in the entire lecture. Okay. Snail, thank you so much. Goodbye and take care.
Yes, sir. Yes, sir. Thank you.
Bye. Thank you.